We are recording. Hi, y'all. I am very excited this evening to be here with Asitima, who I met via our mutual friend Shivangi, who lives here in Newcastle. Asitima is living and working in Noida, India, which she was just telling me is almost like a kind of like a suburb of New Delhi. And she is working for a not-for-profit which deals in eye healthcare provisions to marginalized communities. So thank you so much for talking to me today, Asitima.
Hi, Alex.
And we've had quite the journey because you were in the car earlier with your mask on and I was hearing all the sounds of India all around you. It was very exciting.
The sounds of India were there. You've had quite a journey, I would say.
Yeah, you're like, this is just my life. So before we talk about the current pandemic, tell me just briefly about your life and what led you to your current career.
Okay, so firstly, thank you for speaking to me. It seems like quite one
of course. No. I'm so excited.
So, I have been I'm born and brought up in India, and I did my graduation in India, and that's the period when I started volunteering for an organization, and I love that work so much. So I was working with AIESEC. It's across 120 countries across the world, and it's a youth leadership platform. So I joined them as a volunteer, and I really like the work. I really like the sort of the internal development I was having with it. So I carried on with that organization for 6 years.
Okay, wow.
2 out of which I was staying in Bangladesh for, and 1 out of which I was in Africa, Middle East and Africa.
Right.
So that was quite an experience, and I must say that from the day one when I joined as a volunteer till the last day when I left, on a very happy note with from Africa, from Kenya, I left and I came back home. It was a beautiful development over 6 years, which I don't think you get in a normal experience unless you have a lot of extracurricular and a lot of other diverse activities in your university, etc. So I was very fortunate to have such a diverse experience in the early part of my life, and I got to travel a lot, which and it was always with indulging into local experiences and trying to figure out how to develop the youth potential of that particular country or that particular region. So it was always backed up with this utmost, like this force, the youthful force of nurturing the youth leadership there. So it was a very good experience. I mean, it was a lot of fun, and at the same time, it was a lot of responsibilities, both going hand in hand, and it was fun. So that led me to decide that I want to continue on the same path, and then I came back home, which is where I want to always have my career. Was to work in India itself in developing the country. So I joined this organization that I'm working with now for VisionSpring, and they provide eye healthcare to marginalized communities in the country.
Okay, all right. Now I think I might have missed. I don't think I quite understood. So you, this is more recent, the eye care that you're working with, and for 6 years before that, you were volunteering. What was the name of that one?
AIESEC.
Okay.
AIESEC.
And what is?
I was volunteering in the beginning to 1 year of that experience with AIESEC, and then I joined them as a full-time employee with them for the rest 4 years.
Okay.
And then I just ended it last year.
Right. And is that similar? It was similar work to what you're doing now?
It's very funny that it's similar in the nature of the approach towards the work, but like the culture and the organizations were very different.
Okay.
Like AIESEC was this. AIESEC is this organization existing since 1948. It was created during the time of Second World War. Like the cause of the organization was the atrocities of the World War,
Oh,
and it generated from there. So there's a lot of legacy,
okay.
history, the importance of the preserving the original aspect of it to there. So it has a lot of years of build up.
Right.
Whereas VisionSpring, although it has been, it's a very recent organization, but it has done immense amount of work in the recent past and has, if not the depth over the years, but has definitely done a huge volume of
Cool.
work over now. So yeah, these are quite different in that sense.
But they're both nonprofits, I guess?
They're both
Yeah.
nonprofits.
Yeah. Cool.
And AIESEC is a young youth organization, so everyone there was around not more than 30 years old.
Okay.
So
Okay.
everyone is probably like a college friend, like a university friend. So people are more similar aged. I wouldn't say like-minded, because I think that's one myth that I broke when I joined VisionSpring, because now I'm seeing that having to be like-minded doesn't have much to do with your age.
Ah, interesting. And what you're with now is called VisionSpring. Is that right?
Yeah.
And how long have you been there?
10 months.
10 months. Oh my goodness, right. So really, you were probably just getting to understand the role when the pandemic came along. So can you talk to me a little bit, if that's okay, just what it was like, what were you doing before? And you've told me that things have changed quite a bit since then. So kind of tell me about the before and after a little bit.
Yeah, I think that's a very good perspective you just brought in, because since the time that pandemic hit, I was 5 months into the organization. So maybe for me, the impact on my work doesn't sound so huge, because I was just getting used to it.
Right.
But
Good point.
probably
Yeah.
for some of my colleagues who are like, the routine is into their habit and the mindset is built in. That's why I think I was able to jump to so many new projects easily, because my mind was not,
you hadn't been, you weren't too like ingrained in it. Like you were kind of open to figuring out what was happening anyway.
Yeah. So, although I mean that doesn't mean that there are everyone pivoted very strongly.
Sure. Yeah.
So yeah, when I joined in, my program works. I work in the program team, and it works for providing eye healthcare to children, to school-going children, and with the idea of increments in their learning outcomes. So you like people who wear eyeglasses or have vision related challenges, they usually have problem in studying, and and especially in a books intensive learning, or even if it is a digital more intensive learning, you need your eyes are the major source of learning and taking whatever is being thrown at you. So for children, that's a very big cause, and it's somehow because the challenges that children face in India in the public schools, I would say, and the marginalized segment of the country, there are so many other health issues that they fight with, that eye healthcare has not been a very forefront conversation in the child healthcare. So that's what we keep on advocating for, and we run a lot of vision correction camps, and we provide eyeglasses to children for free, and we keep on doing some things. I mean, right before the pandemic, I was exploring on how I can create leadership amongst school children, so like mostly the senior children, so that we can create, we can help them to advocate for eye healthcare within their school area. And that is the time when the pandemic hit, and as you know, schools have been, educational institutions in general have been closed. So for us, this has been the biggest challenge, that whatever we want to do, whatever we want to go ahead with for children, mostly has to be in a very small area of how to reach children without where they're not going to school.
Oh,
So even if you go to communities, etc.,
yeah,
that's a then that's a very large scale of people that we're talking about. Because if you
right.
go to community, you cannot just tap into the child's life. You've got to incorporate the family
Yeah,
and everything. So if whatever was maybe X amount of children, for any intervention now would mean 10x amount of children. So that's not as 10x amount of people. Sorry. So that's something, of course, on a large scale, that is something for an organization to also look at.
yeah,
So yeah, we've been trying to see how we can support reopening of schools, how we can help in just getting like we're constantly exploring ideas on how we can still provide or we can still advocate, like keep the
yeah.
core of our program alive by keeping that discussion going on about eye healthcare. So yeah.
This is a bit of a surprise question, but I'm just thinking as you're talking about it. What so I guess if like I can definitely I started wearing glasses at the age of 6, so it changed my life. So I can't even
Mhm.
imagine going through school without them.
Yeah.
So I'm wondering, like, for a kid, now that kids aren't in school in India at the moment, um,
Mhm.
is the lack of eye care more concerning? Is it less concerning? I guess, like, is it the same? Like, what I'm wondering how pandemic
Mhm.
this situation is affecting people's eye health.
Yeah,
Mhm.
with respect to children, because learning has now shifted to digital modes, it is definitely a big concern because now
Yeah,
the screen time has increased. So the
yeah,
stress on eyes has increased, and definitely refractive error, like generally the distance vision it will have impact on a child's distance vision, or there could
right,
be other challenges also with
sure,
respect. So it is definitely a big threat. Um, because the major cause of vision related problems for children, if not genetic or if not by birth or some other impact, then otherwise it is nutritional,
ah,
nutrition, or generally exposure uh, to a lot of screen time, whether it's television or anything, or some like, yeah, the same thing. I think that nutritional value is what you lack of some nutrition is what encompasses the entire thing.
right,
So yeah, I mean,
right.
definitely the pandemic has a very strong impact.
We might, all humans might come out of this pandemic with worse eyesight just because
Yeah,
we're
yeah.
spending so much time staring at
I,
screens.
yes, exactly. I mean, we are.
Yeah,
I think I'm not sure, but about the screen time of an average professional, I
yeah,
was reading it somewhere, if I'm not wrong, has increased 4x, because
right.
now we are working on weekends, we are working on call, we are
Yeah.
working anytime and all of that. So yeah, it is
And we're
definitely.
having conversations with friends via this as well. Like, we're all
Yeah,
of this.
exactly.
Yeah, yeah,
Yeah, yeah. All of that, including it's everything is digital. Any kind of
yeah,
connection is digital. Your shopping is
yeah,
digital now.
yeah. And so this is also interesting. Like, something I had not until just now, like, thought about at all, is like pandemic and eye health. So really interesting.
Yeah.
Did you and you, I guess, have been working, so you were working in an office before, and
Yeah.
now you are working from home as well a majority of the time. Is that
So
right?
most of the organizations have, most of the offices have opened in India.
Okay,
With
really?
the
Okay.
government, yeah, with the government. So when the government started the unlocking procedure,
Mm-hmm.
um, if I'm not wrong, it was so after a certain period, in the beginning, most offices were all the offices were closed.
Mm-hmm.
Then offices for essentials were opened with a certain capacity dependent on the industry, and then so and so on. But now all offices are open.
Okay.
Unless it's a containment zone, and then containment zones have their own regulations. However, So we've been going to office, but again, not at 100% capacity.
Okay.
So it's being divided, and it has rotational, like we have rotational shifts.
Right.
So yeah, with that, and during my office rotations, I am at office.
Okay. Okay. And so you're going to the office, but all kids in India aren't back at school yet.
No. Schools
Okay.
haven't opened.
That's interesting.
Yeah.
So schools haven't opened at all. So I guess they find, I guess that the Indian government would find that it's more risky to have schools open than offices.
Yeah, it's actually a concern all across for all the governments, because with school being the target population being at question here is the children.
Okay.
And as you know, this pandemic, the virus hits people with less immunity or weakened immunity higher.
Mm-hmm.
Children at that or at whichever ages are still developing their immunity.
Yeah. Okay.
Making stronger. So that's the primary concern why schools in most of the places have not opened yet.
Okay.
And if they are opening, then they are with extremely strict regulations, extremely strict regulations. I think more than offices. Yeah, with the idea, firstly, it's children are at more risk, and secondly, the future of any country. So, yeah.
Yeah, interesting because some of the other countries have not had I don't know even if Australia ever even completely officially closed the schools entirely. They encouraged people to take their kids home or keep their kids home if they could. But I think one state might have, so, and in the United States it's different. So, but and that's another interesting point because we're still learning about this virus. So we don't know necessarily what the long-term effects are. So it could be something where this sounds quite cynical, but if kids got it, they might be fine, but we don't know how that might affect them in the long term either. So
yeah. I mean, in my personal opinion, I feel that with definitely certain rules and regulations, I think schools will open. Maybe not for the younger children, but for the seniors, yes.
Yeah.
That's my personal opinion, how I see it. But yeah, definitely it requires a lot of careful, precise, mechanisms to it. And not just that, it also requires a huge behavior change, because now we are talking about regularly washing your hands, keeping a mask on, protecting people around by just certain public etiquettes, etc. So that even at your house, you might just once or twice you may just slip it, or you may just not do it. But at a school sort of a situation, it's extremely important to not miss these things. So it is a behavior change, and it definitely requires a lot of support. It's not something that a school alone can do. It requires healthcare interventions. It requires a lot of support for getting children back to school, definitely.
Yeah. Is it common, I saw you in your mask in the car earlier, is it common to see most adults right now where you live wearing masks?
Yeah. Everyone.
Really?
Yes.
Yes.
And people are, if you are not wearing a mask, then you're most likely to be called out. And
really?
Asked to,
okay.
It's something that people have been doing on their own. So that's a behavior within the citizens, and it doesn't really require a law, like a professional,
a mandate or something.
An official to come and remind you, but it's something that people are doing by themselves.
Has that ever happened in India before, that people would wear masks like to that capacity?
Yes.
Yeah.
Not to that capacity, but a while back in the last winter, Delhi was facing a huge pollution crisis, which is why we were wearing the N95 mask.
Right.
That is completely on it's not something that goes from one person to another. So it's not mandatory, but
it was for your
Yeah.
individual kind of concern. Right.
Yeah.
Interesting.
So even though, I mean, yes, in closed residential complexes, people are very vigilant and they're talking and telling each other, requesting each other to wear masks, etc. But of course, I mean, there are places where
Sure.
maybe marketplaces or something where people might not be that aware.
Right. You were mentioning how India has adapted so quickly since it has happened, and it's almost like things have kind of gone in waves.
Yeah,
Yeah. So I was wondering if you could talk to me about that a little bit, like what it was. Tell me when you first realized it was going to be a serious problem, and then kind of talk about how it's shifted since then. Yeah.
I mean, I don't know exactly at what point I realized that this is okay. This is really serious. But I mean, yeah, the pandemic was going on in the different parts of the world. And in March beginning, we were still wondering whether it's entering India or not. We knew that okay, it is going to touch the country, but I mean, in the beginning of March, I traveled to another place,
Mm-hmm.
um, and everything was going normal. We were just still talking. Some offices were doing work from home, some were not. And then at the end of the later part of March is when things started to close down, and then the government finally, uh, established a complete lockdown.
Mm-hmm.
And ever since that, the country has had different phases. Like particular states have been hit very bad. So initially there were 4 or 5 states which were hit very very awfully. Sorry, and some states were faring better initially, and then those states which were faring well started to hit bad. And
Yeah.
then there are new news coming out and something or the other, some incidents happening which were like just after every 2 or 3 days you would just hear a new breakout somewhere in some part of the country. And we're talking about a country which is enormous,
Yeah.
both in size as well as the density of population. So it is very difficult to have a blanket strategy
Of
overall.
course. Yeah.
I think I
Oh,
still think that it's been a decent job by the government, because
yeah.
like it required decentralization, and that's what happened.
Mm-hmm.
Yeah, it was controlled to a huge extent. Otherwise, we cannot even imagine things would have been much more serious by now. But
Right.
it's tiring, it's exhausting because it's not getting done. Like it's still soaring up. The
Right.
graph has been very slow for India. I mean,
Right.
yeah, it's been
Right.
very slow and it's still hitting people. Uh, Although the death rate, the fatality rate has been low as compared to a lot of
Yeah.
other countries.
Yeah.
But we keep on hearing about the new cases. Every day it's a new peak on
Right.
the day of cases, and also it's disheartening a bit because yeah, it's like for I would have hoped that I would have hoped that this pandemic was never here, first of
Yeah.
all.
Same.
But
Yeah, of course. Of course. Yeah.
yeah, but I wish that it was also like more compact, because right now it just feels like, I mean, the way that I see everyone's reaction and the way the people's general sense is right now, it's like a cliffhanger. We don't know, what's next, because every in the last 2 months, every time when you see that, oh yeah, it's dipping, it just picks up after a point, and yeah.
Yeah, yeah. We've experienced the first kind of situation with that over the past 2 or 3 weeks in Australia because we thought we had almost eliminated it. And now all of a sudden there's surges. And it's
Yeah.
just like, it's such a defeating feeling because you feel like, you feel this hope that you'll get it under control. And I can't even imagine because we've got like 26 or 27 million in all of Australia. And India, as you said, is over a billion
Mhm.
people in India. So, I mean, I can't even imagine how the government has had to come up with
Yeah.
strategies and
And
planning.
it's quite what do I say, I think it's a privilege to even have this feeling, because I mean, with all luck in our favor, we haven't been on the other side of those people who have actually faced the pandemic, with the virus affecting
Yeah.
them.
Yeah.
Whether or not that led to a fatality, but I mean, even having this feeling, so it's such a diabolic thing, right? You have this feeling of exhaustion, but then you also feel that I'm so privileged to even
Yeah.
have this feeling. Like, should I
Yeah.
even feel like that? Because there are people out there dying out of
That have it, actually have it.
or are affected by someone else's infection. So yeah, so
Yeah.
that's quite it's
Have,
not a good time, but I
yeah.
hope, like, I think that's also like, on a very hopeful note, I feel this is quite a great learning for all of us, for mankind in general,
Yes.
uh,
Yeah.
for our country, because apart from the health risk and health impact that it has brought on to the country, it has also gotten the economic impact on the country as well as the world.
Yeah.
And it's a good time to revisit and see how we are, what is the relationship with money, with
Yeah.
income,
Yeah.
how we are generating income, how we are, what kind of uh, systems are we building around ourselves, and what exactly do we value. So it's quite a
I think you're totally right. It's like it's like everything is connected, and we're finally like thinking about, as I said, I think the most vulnerable. We're only as good as the most vulnerable person in our community. I think so. We're thinking from the healthcare, from the economy, from the environment. Like it's
yeah.
all just I mean, it's really sad that it's all kind of falling apart, but it's also really insightful. Did I know that in the US and in Australia, the government tried to give some stipend or some financial assistance? Did
Mhm.
that happen in India at all?
Yeah, it
Oh,
did
really?
happen
Uh-huh.
with now. So again, the economic levels and layers also are very diverse here.
Right.
So in to a certain criteria of population, the government gave them financial support.
Mm-hmm.
Certain population, the government gave them subsidized food,
Mm-hmm.
subsidized dry ration, and or free ration, whichever.
Okay.
And we also saw a lot of COVID relief work coming along in different parts of the country.
Okay.
However, no matter what, there was a huge population of workers, daily wage laborers, who were displaced,
Yeah.
and the bottom of the pyramid, basically the bottom of the supply chain,
Yeah.
has been impacted the most. And yeah,
Yeah.
like, it's for them to avail something like a financial support, they need a
Mm.
bank account. They
Right.
don't have it.
Yeah.
For them to have to avail subsidized or free food, they need to be located at one place. They got
Right.
displaced from their locations. They were paying rent in a city where there probably are construction workers, and the construction stopped. So now they can't pay rent of the small space where they were living. So now they need to go back to their village. They don't have money for that. They don't have transportation for that, and what is the point of food, free food for them if they're constantly moving. So yeah,
Right.
this category of people were not able to avail much from a lot of things which were happening,
Right.
and yeah,
Would that be
that
a
impact.
huge portion of the population?
Mm, I'm not sure about
Yeah.
the portion, but
Yeah.
it was definitely a good amount of
It would be millions and
people.
millions of people in India, I would guess.
Uh,
Yeah.
I mean, I'm not sure if exactly in that
Yeah. Yeah,
proportion.
sure, sure.
Uh, yeah, it depends again, because again, uh, the problem with this cycle is that now these people have gone back, and if they find an alternate mode of work, when the economy runs back again, will they come back? Is
Yeah.
because they are, no matter what, they are the ones who are the brick and stones of the entire system.
Yeah.
Even if we value them the most, they are. So
Yeah.
that's quite a
Yeah.
that's a thing. So
Yeah.
yeah.
Have you met anyone personally who's had the virus?
No, not
No.
yet.
Okay. Wow. What could you tell me a little bit about I know nothing about what the healthcare is like in India?
Yeah. So, I mean, do you have anything specific in that area that
Like,
I can answer?
is it,
Ask this.
yeah, so I'm just, yeah, I know, I'm asking about like, it's basically like,
Yeah.
tell me about Mars. um, can you, so I've asked a few different people about the healthcare systems. I know about the United States. I know about Australia quite well. Australia has, I guess, universal healthcare, so government funded healthcare, which is something that I never really experienced until I moved over here. In the United States, I think good healthcare is available, but you have to have the money to pay for it.
Yeah.
I know that I talked to a doctor from Colombia, and she was telling me that there's basically like a like level that's all the public, and then people above that with better jobs kind of help pay for the public, and then there's also like a military healthcare too. So I mean, is like how does every individual have to pay for their healthcare, or is it more like a government funded? Yeah.
So, like one thing is, of course, your health insurance.
Okay.
That covers COVID on a different level. And apart from that, there are different kind of hospitals in the country. So the public hospitals already provide testing facilities at a very subsidized cost. In many of them, in fact, in many states, the public COVID testing in public hospitals is free of cost.
Okay.
But then again, it is an expensive disease. I would say that
Yeah.
it's quite, sorry, not a disease, but the treatment is expensive.
Yeah.
So yeah, it's I mean, from what I know, and I'm not backed by stats a lot here, but as much as I know that yes, the government public hospital facilities have been pretty subsidized.
Okay.
But at the same time, most people who can afford would opt for private facilities also.
Okay.
I mean, equally, because India's healthcare system is pretty good. It is advanced, I would say, definitely. At least it can pace up with something like the front runners of medical innovation across the globe. So we do have the pioneers here. They've been working hard as well, on providing testing facilities to people. Although in the beginning testing was across the world was quite a fiasco.
Yeah.
Remember, it was not so available, and in a developing nation, it becomes very difficult because not just that you have to make it subsidized or affordable, you have to also make it organized. You have to plan.
Yeah.
Because we're talking about a huge amount of footfall. We're not talking about a small proportion of the population. We're talking about a big population, and you have to take that into factor. Like one of the best hospitals of the city is situated in New Delhi, and it's a public hospital, and central government governed hospital, and it has people coming in from all over the country and the world. In fact, like there are a lot of people who come from the neighboring countries come to India for their for medical support.
Right.
And this is the hospital. Everyone turns their eye to for support. And I mean, I can afford private healthcare, but I would still go to them because I know that
they're good.
They're good, yeah. And they've been struggling with the amount of footfall that they have had.
Right.
To the extent because now people started also traveling if they have COVID symptoms.
Right.
Get to the hospital and get themselves treated. So that became a bit of a problem.
Because then the last thing you really want is people to travel, right? If they have the symptoms, because then or if they have the disease. because then it's you might be going to get the best medical attention, but you're bringing it with you.
The virus is traveling with. So although there were like it's been quite a situation, but I still feel that yes, there is sufficient infrastructure here in the country at this point to tackle the virus.
Right. So that's interesting. And so there's a public and private healthcare system. So there's two, and sometimes if you're in the right place, you can get really good public healthcare. But there's also some places perhaps that you prefer to have the private healthcare. Right. Interesting. And you said the tests are mostly free to get tested at this stage? Most people can get tested for free?
Not mostly, but at least there are available free tests, testing facilities by the government in the government hospitals.
Okay.
They must be having a cap to them. I'm not sure exactly how much.
Right.
Yeah. But then, yes, there were certain innovations that the Medical Research Center had here with low-cost testing facilities and low-cost testing kits. So I think the government also embodied that, and that's why it was very possible for mass testing also after a while. If not mass testing into all the communities, but at least in certain hotspots that were really like they were ready to explode sort of a place.
Right.
So certain slum areas, which are extremely vulnerable to something like this.
Right. So you want it to be the best thing that can happen is just like really available, quick, fast mass testing in places like that. Right. And you mentioned the offices. I wanted to jump back one more kind of question. I was just thinking, like, because I've never been to India. I would love to go. It's definitely on my to list. But a lot of people, like from what I've been told and movies I've seen, it's just like a lot of activity and action and movement a lot of times. So if that's fair to say, and I just was wondering, like, did where you were, did you see it get quiet? Like, did you feel like people were staying in? You're quiet.
Yes. When the lockdown was happening, again, so because there were certain central government guidelines, but most of the lockdown sort of the laws and everything were the guidelines, and not just the guidelines, actually the rules and regulations were district based or state based.
Okay,
so they were
right.
And the law enforcement bodies like the traffic police or the police in general are also governed by the state governments. So it varied from state to state.
Right.
Where I live, it was top notch. I mean, I couldn't see a person if you don't have a valid reason to move, you're not allowed to move. It's simple.
Right. So would they like use law enforcement to?
Yeah, they did.
Right.
They did.
Right.
It was from the day that the lockdown started. They used law enforcement for that, and they also started a very good digital system of availing an e-pass. So if there is a reason that you need to travel, you need to just get that. You need to get a pass from the government website. If you get it, then you're free to go. And you will be checked, but you can always show that. So, I mean, it was a good system. So I mean, I didn't move much, but I, even in my relation that I know people and all of that, I saw people, it wasn't, so much of an inconvenience.
Yeah, sure. Were you surprised?
Used. Sorry?
Yeah. Were you like, was it strange? Like, I mean, where you live is usually quite busy and crazy. Did you find that it was it surreal? Was it strange?
It was surreal because it was like just silence. Usually the streets which are full of cars. I mean, it's not that anymore. It's been 2 months that it's not like that.
Yeah.
The moment things started opening, there was still the city got back into action.
Right.
But,
Right.
Yeah. But I mean, that's why it's not a very old feeling, but in the beginning it was quite very silent, and I was
Yeah.
loving it. I
You're like
think
a bit of peace.
the lockdown has made me not so a city girl anymore.
Yeah. Yeah, it's changed us all, I think. Were there any protests in India in different, I know that Brazil, my friend in Brazil was telling me there was protests. There's protests in the US that,
Against lockdown?
or just like any, so like I know that there's been a huge movement, like there's the Black Lives Matter movement. Then in Brazil, there was like union protests, she was saying. In the States, there were also people protesting their right to like go out to eat.
Oh, yes, I saw that in the news that is happening, and I reserve my comments on that.
Yeah.
Why?
But did anybody protest in India at all for anything?
Against the lockdown, no.
No.
I think I haven't seen the country so unified on the opinion that okay, we need a lockdown and we need to take these measures. But there
Wow.
were certain ongoing protests. So there were a few ongoing protests, but they were also called off for
Okay.
the lockdown. So the lockdown regulations weighed up on those protests.
Right.
And like a very massive protest was going on in Delhi itself. And I now that honestly that conversation has just gone off.
Right.
Do
What was
nothing
it?
yet. People are not. It was about. I mean, it's a very vast topic. So it
Sure.
was about the NRC, which is like basically it is about the people who have migrated from different parts of Bangladesh, like Muslim countries, and
Okay.
however they're coming from the citizenship of people who are coming from Muslim majority countries. And it was, I mean, again, I reserve my personal opinion
Sure.
on it, but it was a good, like, the country had the citizens, I would say. It wasn't a government versus citizens
Yeah.
debate. It was a citizen versus citizen debate.
Right. Right.
Yeah,
And
it represented both the arguments represented the country. But now it's not in the yeah, now it's not really in the highlight anymore because there've been so much after that.
right.
I'm seeing protests happening digitally now. Things are moving to
Sure.
that. There
Sure.
was one protest by the workers who wanted to travel back from the major cities back home,
Yeah.
and they wanted transportation, they wanted trains or something to go back home. So the government then did provide free or very subsidized train
Oh,
journey. Yeah.
interesting. So one of the first one you were telling me about kind of just kind of like because of the lockdown laws that kind of the issues were lowered, but then there was the one about transportation and they protested and then they got what they wanted.
Yeah, they eventually got it because it wasn't just the protest was conducted by a very small proportion of the people who act out of the people who would have been impacted by that result, because lockdown was sudden here, and there are
Right.
so many people who were probably traveling for work or traveling for some leisure or just working in some other part of the country, and now they were locked in wherever they were, right? So
Right.
there was a huge population of people who needed some mode of transportation to go back home.
Right.
So although the protest was by a very small group, but there was a huge, it was a very valid reason basically. So the government didn't just move. I'm sure the government moved because it benefited a larger group of people.
Yeah. They saw a lot of common sense in that. It sounds like. Yeah.
Yeah, exactly. They saw a lot of common
Yeah. Right. I don't want to take too much more of your time, Asitima, and I just have one or two more questions. I was curious, you mentioned earlier how you've lived in a few different places in your life. How do you feel? It sounds like it's been so enlightening talking to you just now, but like it sounds like you feel that India's really doing pretty well compared to the rest of the world. Would you say in terms of handling how they're handling the pandemic?
I think one thing that traveling teaches you is that the world cannot be compared under the same umbrella. You cannot compare Australia, for example, with Taiwan, with the
No,
United
yeah,
States, with
absolutely. You're right.
Kenya, or with whatever. You cannot compare. So when I speak of the progress that India has had, or the way that it has tackled the pandemic, it's such a unique state of circumstances. I can't compare it with Brazil, for
Sure.
example. Like, I mean, Brazil has had its own challenges with the pandemic.
Yeah.
UK has had so many challenges
Sure.
with the pandemic, but everyone has dealt it in their own way, and that's why I am I mean, if you put it in a comparison, it might seem that I'm talking like, yes, I'm very, I'm saying that it's better, but I'm not. I am optimistic though.
Yeah.
I am optimistic, and I'm happy to a larger extent with a lot of things. I do feel that there could have been better approaches also. I also have that strong opinion that certain things could have been better. Certain things could have been better from the government side or from the people's side in general, like citizen. I don't think pandemic is a place where you can just, put all the blame on the governing bodies.
Of
It
course.
has a huge role to play from each one of us.
Yeah.
I mean, if you're privileged and if you're at home, then you could do something for someone in need. And that's what social sector, my career line, is all about.
Yeah.
I think if this is not the time, when the people, the citizens come out and do something, then I just think that we need to revisit a lot of questions.
Yeah.
A lot of things out. So yeah, I think it goes hand in hand. Yeah.
That's an interesting and accurate point, and you can't compare them, but I do love learning about each of them and how things are different. Like I do find it from what I've heard and read and talked to people in Brazil, there's I think because of their president who's been very dismissive about the virus, so that I think causes a bit of animosity within the people. So it's really interesting that you say that you feel like most people in India have taken it, have come together. Like there's no doubt that this is something you've got to work towards, I guess, collectively. So that's interesting.
And even I also believe that maybe even if someone has, like, yes, some people might be dismissing the existence of pandemic altogether.
Yeah, sure.
But it's not a public sentiment. It's not something which is coming in front of a group of people. So at least the people as well as the government has put out the idea that this is serious and we want to take these precautions. So even if you have a even if you have a personal opinion against the pandemic, then you keep it to yourself.
Right.
That's the kind of I think notion here. And that's also because I think early on there was a huge amount of adoption. I would say, I think the medical progress that India has made has a lot to do with this. Because if the medical associations did not have the right amount of influence on what should we focus on, then this wouldn't be here.
Right.
I mean, they have that kind of scientific framework to everything, and a logical thought behind why this needs to become a government priority, a national priority. So it is there. If we didn't have that advancement, maybe our medical associations wouldn't be so. I mean, I don't know if association is the right word.
No, but
the Ministry of Family and Health wouldn't be such a important factor if India was already not a little bit more like that medical level that it is at.
So I guess there's a lot of because the medical and doctors in India are doing so well, maybe there's a lot of trust in the people trust, and then there's power. They have power because people trust them kind of. So it's kind of like they've
Yeah,
yeah.
and India has faced and its history with previous outbreaks,
Yeah.
like a polio outbreak or something like that, has been there, which is why because these things, public awareness, like
Yeah. Yeah.
public awareness messages to
Mm-hmm.
transmit into the entire country is not such an easy task.
Right.
So it can only happen because each level, like in terms of the healthcare system in the country, each
Mm-hmm.
level was already prepared. They knew that
Yeah.
how do I get the information to the most unreachable person in the country as well. So they
Right.
knew this already. That's why every household knows. I mean, I'm talking about a country where mobile is not even accessible in many of the
Yeah.
cases. They don't have WHO telling them through Facebook, and even if they have a
No.
mobile phone, they're not looking at these kind of things, right? So how to get that information to medical information to these people, because we've done these things in past. That's why the system was already there, and that's why
Right.
public awareness was so much easier
But
for the country.
that's so interesting because it makes me think we have in I think in the United States in particular such a problem with
Yeah.
getting accurate information, even though everyone's got cell phones and
Yeah.
well, not everyone, but a lot of people have Facebook that's telling them stuff. And it's almost like maybe, and I love social media, so I can't believe I'm saying this, but maybe another method of delivering information might be more effective in getting
Yeah.
results. Like I'm sure that these campaigns and the way that they like the way that like the work that you do with the glasses, even like it's not all based on a Facebook campaign, right? Like it.
Not at all. I mean, we're
Yeah.
talking about people who they don't use a cell phone to get these messages, basically.
Right. Right.
They do, and you probably need a microphone and need to announce it everywhere, or you need to put posters everywhere, or you need to
Right.
you need to be innovative with these kind of things. So because the country had experience on this,
Yeah.
that's why if the top decides, okay, we need to transmit these messages, then each level is already aware, okay, this is the best case practice at my
Yeah.
level.
Yeah, and you've seen it, and because you've had scares with, I guess, pandemics as well, then you kind of say, okay, we know that this worked last time.
And there is already a very strong level of trust between the local community healthcare worker and the people in that community. So they already know and they already trust this person. So there is a system of that in India, which is called ASHA worker. So these are local community healthcare workers who usually provide, they are the solution for basic community healthcare needs. And this is one person that the community will always rely on. And these kind of people are the ones who are the front bearer of, apart from the healthcare system, definitely, but apart from that, these people are also very important in delivering these messages. Now, if the country did not have something like this, it would have been extremely difficult. Now,
Really?
and I don't know. I mean, if we are taking the example of UK, I don't know what systems exist there, but I'm pretty sure like something like a outbreak sort of a system did not exist.
No.
Pandemic is once in a. I mean, I think many
Yeah.
of us in our lifetime are facing a pandemic for the first time, but so
Sure.
many of us have experienced an outbreak earlier. So at
Right.
least that level was pretty. That's where the experience counted, I guess.
Yeah. So interesting. Yeah. Yeah. And because of that, like there's less doubt of like, some people think it's a conspiracy theory or something like that. And because you've been there before, it's much like, okay, we know the drill. It's like preparing for an earthquake or anything else, isn't it? It's just like understanding that having a system in place, like in some ways, it's so simple. Like this is another disaster plan, a plan like planning for different types of disasters. It's just that I guess we've been a bit spoiled that we haven't had that happen. So now we're all in a tizzy, and people in India are like, yes, this is right. Okay, this is what we do now. You go to this person.
I know this part, but yeah, of course, you know, the
Yeah,
economic
yeah,
impact of this has been just, that
yeah,
has just stopped the entire
yeah,
effect of the pandemic. It's like doubled or tripled the effect of the pandemic.
yeah, yeah. That's the hard thing though, is that even if you have perfect systems in place, there's other, like, you can't
Yeah,
prepare for everything,
you know,
unfortunately. Yeah,
everything you can. Yeah, you've got to, you know, give perks and benefits and keep your frontline workers motivated. For that, you need the economy running. There's so many other things which
yeah.
have come to me right now. Yeah.
Yeah, yeah. Have you I know that you told me earlier that you're basically working all the time. So so it's
Yeah.
but so I guess in some ways, like, I'm so happy that you're able to work, and also that you're able to work doing such a cool and important thing. But it sounds like overall you personally have been doing okay, but I'm sure just the weight of everything has been quite intimidating and exhausting. Have you seen any silver linings? Has there been any, like, thoughts about how this might be positive somehow in the future at all?
Something that really intrigues me, or I don't have a, you know, like a academic background of, but
Mm-hmm.
I do feel that this, if studied the right way and if understood the right way, then this could give us a very good, you know, framework for how to rebuild an economy.
Mm-hmm.
uh, because now we know where, I mean, a lot of awareness about, you know, what kind of manpower is needed for the kind of future that the country needs to build, or the world needs to build. I would just speak about the country aspect because globally it's a
Yeah,
very big topic.
sure.
But yeah, it's a very great space to start on and rebuild the economy, understanding what, um, and what, you know, because the entire supply chain got affected,
Yeah.
first thing, by this thing,
Oh,
right? So
for sure.
how to make, and we've come to see that supply chain was such an essential part of the
I know.
entire everything. I mean, you
Everything.
talk about food, you talk about clothes, you talk about anything. So, I mean, this gives us, I'm just taking example of supply chain. So it gives us such a great time to really explore how to strengthen it, um, how to make it more self-reliant, how to make, how to feed your people by strengthening your supply chain. You know, how to make these things stronger in your economy. So these are the kind of things I think that can come out great from a pandemic like this.
I think that's a
Or
great
we can
answer.
hope for a better future.
I think that's a great answer, and I've thought about that as a lot as well, because I think just like everything else, everything has been laid bare in our own countries. We realize, like, how much we get from other places, and
Yeah,
if we don't have a backup plan,
yeah.
like for medicine or for food or for
Mhm.
other people to buy our food, even, or our supplies, like, I'm still believe in globalization to a degree, but we need to be able to have alternatives, and so that I
Yeah,
think that's a
totally.
uh, or
Yes. And of
or
course,
yeah,
globalization is still valid because there are
yeah,
countries who do not have the geographical, you know, benefits of
mm-hmm,
doing everything for themselves. They are relying on their counterparts or their neighbors, etc. So, I mean, yeah, the supply chain needs to go, and we need to make things stronger. And this is such a good way to know that
yeah,
where the problem
yeah.
was.
Maybe we're in some ways it'll help us. We'll stop something worse from happening in the future by dealing with it now.
Lessons from COVID-19.
That's great. Is there anything else? I've taken so much of your time, Asitima, so thank you so much. Is there anything else you want to include before I let you go?
Uh, yeah, I think I would just say that keep your mask on, everyone. but but apart from that, I mean, this mind is such a big thing for us to sail through this. So just I think that being nice and being kind to people is the greatest gift that we can give everyone. So that's all. I mean, I'm not. I don't have any big message.
No, no, no. That is
Stay healthy type would be good.
That's gorgeous. That's a great, I think that's a deep and meaningful and very important message, both of those things, masks and being kind. Like, I think that's going to get us through this. So I think that's great. Thanks so much.
Thank
Thanks.
you. Thank you so much. I love speaking with you.
Yeah, it was great. Thanks.